Monash Partners is the first academic health science centre to be established in Victoria. Academic health science centres are organisational structures that link basic research to clinical studies to translational outcomes.
Monash Partners creates a space for people from shared communities to come together, form wider communities, so that we can focus on creating the research and improving the health outcomes for people across all of our communities.
There are a number of academic health science centres that have been established in the UK and the US that have been highly successful and have led to improved health outcomes.
We had seen the vision of Monash Partners as a collaboration between public and private health services who wanted to come together to improve the quality of what we do, improve the patient's experience, doing this through improved integration of our services, more connections between our hospital services for patients, and learning from each other about the way in which we can do things quickly and well.
And from Cabrini's perspective, we created it for three reasons. The first was we have strong existing collaborations with the partners and we wanted to strengthen those. The second is that we think we can improve health outcomes for the community and for individuals through better coordinated health research. And thirdly, we wanted to support the Cabrini clinicians who are engaged in and passionate about clinical research into improving health.
The 8 member organisations of Monash Partners make use of 2 major precincts to deliver basics discovery into the clinical practice. They are the Alfred precinct and Monash Health Translation precincts. Both of these precincts are designed to fuse scientists with clinicians to advance clinical practice from the bench to the bedside and back. The discoveries that happen in the labs in those 2 precincts inform clinical discoveries, and again the clinical discoveries which are found inform our basic research agenda.
The things that researchers look at are based on questions that our clinicians have, and our clinicians are able to have conversations with researchers about the sort of questions that would help them if only they had been answered to improve the care of patients.
A really key part of this includes the linking and translating of research that we find as we're actually working through all of these processes with our partners.
I'm the head of the Critical Care, Trauma and Perioperative Medicine theme in Monash Partners. It's enabled us to enrol southern hospitals, public and private, in exciting NHMRC trials, blood transfusion and fluid therapy. It's enabled us to design a new study to improve safety of surgery in the southern hospitals. And it's enabled us to build a new future research collaboration focusing on mental health outcomes after critical illness and after anaesthesia.
I had the theme on infection and inflammation, which covers a really broad area of medicine and includes laboratory-based scientists, clinical scientists and people that work in public health. And we've created an executive that covers all the different sites where Monash Partners work, and we're trying to target some key areas such as vaccination of people and infections in hospitals. And what the Monash Partners offers us is an opportunity to really extend our reach to conduct clinical trials, and with the overall aim as well of also looking at translating basic research into clinical practice and finding some clinical practice trying to answer that in the laboratory.
Our theme brings together scientists and clinicians to work together to improve the health of women and children in Australia. We have developed 5 key strategies in translational health research to ensure that Monash remains at the cutting edge of innovations in patient care to improve the health of our community.
Over the next 3 years, Monash Partners are focusing on primary care and patient experience outcomes.
We realise that if we're going to advance academic health sciences, we need to improve our data series. So if we want to improve our management, we've got to improve our measurements. What we're trying to do at Monash Partners is enhance on the already strong registry capacity we've got through the departments at Monash University, and we also need to increase the knowledge we have about what patients require and what patient outcomes we've got to track.
We would hope to access new and novel treatments, maybe include more patients in research opportunities to experience newer treatments and therapies, across the full spectrum of disease, from chronic disease, acute disease, rehabilitation.
Epworth Healthcare is committed to a strong program of education and research. As a founding member of Monash Partners, we're excited by the opportunities that we believe will arise to participate in and develop state-of-the-art educational programs and to collaborate in cutting-edge health and medical research.
We work on big problems for the health of the community like heart, stroke and vascular disease, diabetes and the like, and we need breakthroughs, and those breakthroughs will be transferred much better and much more quickly into clinical practice, into the health system through an alliance of hospitals, universities and research institutes like this.